with genetic modifiers, somatic expansion in mutant Huntington in the brain really is an important concept. And that means there's further expansion of CAG in somatic cells. And GWAS studies in the past have shown there are several loci which contain genes involved in somatic expansion. And a lot of them are involved in DNA repair, specifically mismatch repair. And the age of onset is associated with these loci. And even more excitingly, in terms of therapeutic potential, inactivating these mismatch repair pathway genes can reduce or have been shown to reduce somatic expansion. So, for example, MSH3, if you knock out MSH3, that can reduce CAG expansion. So based on those findings, there's a phase 1 study being planned sometime this year that targets MSH3 and this ASO would lower MSH3 and hopefully that'll show some good results. And then in terms of other exciting findings having to do with somatic instability, somatic expansion, instability, but more favoring expansion is the case in HD. And that's been measured directly at the single cell resolution. And that does show very high selectivity for medium spiny neurons. It's been known that somatic instability varies among different tissues. But this study, which was the data were just revealed or disclosed at the CHDI conference just a few weeks ago, this really shows at the single cell resolution that there's very high specificity and selectivity for medium spiny neurons for somatic expansion.